Hello, and welcome to Franklin Forward FAQ, a weekly video series answering questions from Franklin County residents about COVID-19 and how your family can safely navigate these unprecedented times. I'm Dr. Linda Thomas-Worthy, your host. Each week, we will hear from local leaders providing answers to your questions based on guidelines and recommendations from reliable expert sources. Joining me today are Dr. Michael Colli, Chief Medical Director and Director of Pediatrics at Keystone Health, and Dr. Tod Kline, Superintendent of Waynesboro Area School District. Hello to you both.
Hi, Dr. Thomas-Worthy.
Our first question today is about how to safely reopen schools. Some schools are opening virtually and some are opening with a hybrid model. It's very difficult to know the best way to open. Dr. Colli, you have been providing guidance to school administrators in Franklin County about how to reopen. What guidelines have you been using to make recommendations to school leaders?
Well, thank you for that question. And I'll start by saying that reopening schools is really a balancing act of some sort. You really have to balance the risk to the children and staff of contracting COVID-19 versus the risk to students of not having that live in-person education, which we all know is very important for our students. And this interplay can be very nuanced and can vary upon a number of different factors that include the prevalence of COVID-19 in our community, the testing capabilities in our community, and the ability to perform effective isolation and contact tracing if you have a positive. In addition, there is variability of the prevalence of COVID-19 in our community from month to month. So the recommendations on whether to provide in-person education really need to be fluid. You need to be able to adjust to changes in the prevalence in your community that can vary from week to week or month to month. I believe it's also worth mentioning that several national organizations, including the CDC and the American Academy of Pediatrics, have both come out advocating to reopen schools for live classes when it's safe and feasible to do so. And both have created safety protocols that kind of go over how you can implement a safe environment for students to come back to school. And these protocols include things like physically distancing when you're at the school, enhanced cleaning protocols, checking symptoms of students and staff upon arrival, and ensuring that everybody is universally masked. But how do we really know that it's safe to reopen? So fortunately, the Pennsylvania Department of Health, in conjunction with the Pennsylvania Department of Education, have both created school reopening recommendations that are based upon the level of transmission in our county. And that level of transmission is based upon the prevalence rate of COVID-19 here and the percent positivity rate that's here. What do those two things mean? Well, the prevalence rate is the number of people right now in our community who have COVID-19. The percent positivity rate is the percentage of people who are tested for COVID-19 who test positive. And essentially, you want both of those numbers to be low. The lower your prevalence rate, the lower your positivity rate, and in general, the less COVID-19 you have in your community, and the safer it is to bring people or kids back to school. Currently, based upon our most recent data, Franklin County is considered to have a level of transmission that's in the moderate range defined by the state. Therefore, based upon this guideline, Franklin County school districts are recommended to either be in a fully remote or a hybrid option. But ultimately, even with all of these guidelines out there, the bottom line is that each family really needs to decide what makes the most sense for their children. When given options of how to return to school, so if a school district offers remote, hybrid, or full in-person, each family really needs to decide what makes the most sense for them. If you have a vulnerable person living at home that you're caring for, and maybe sending your child back to school full-time doesn't make the most sense. So ultimately, even with all these guidelines, I think each family, it's incumbent upon them to make the decision that's best for them.
Thank you, Dr. Colli. for that information. Our next question is about the importance of understanding how these guidelines are being implemented in the schools. And Dr. Kline, would you please tell our listeners how the Waynesboro Area School District is implementing these guidelines and how other schools in Franklin County may be implementing these guidelines differently due to the things like the size of the school district?
Sure, Dr. Thomas Worthy. I have to agree with Dr. Colli and everything he has mentioned, particularly about families making their own choices of what's best for their children in their situation. And we agree with that here at Waynesboro. And one of the things we did as we opened up to meet some of those demands is that we offered several different options for families. One, in person, which we feel is a great need for many of our students who need that face-to-face, that in-class, that interaction with our staff who really want the best for them and are working very hard with them. Plus, we have offered online version and also a hybrid type version where the teacher is recorded. So with that, and we have some other options which can be worked through with our administrators, but some of the other things, one of the things we found was difficult was social distancing. We are doing the best we can. We've put in some various different schedules throughout our buildings to try to distance students. When you have all of them coming back, or the majority of them, it's very difficult. Those buildings are not very big to socially distance, but we have required masks. We ask kids we give them options. If they don't want to wear one of these masks, they can wear a face shield, even wear their cap, which we don't normally allow, but we're being very cooperative this year with that, and use the visor shield, those types of things. We are cleaning in the evenings after everyone is going. That's where our staff comes in to do cleaning. One of the biggest struggles has been our transportation, our buses. Trying to keep the windows down. We'd have to have 5 to 7 times more of the buses. We couldn't get them if we wanted them anyhow. And it's a huge cost, but we've noticed a number of parents starting to drive the kids more, so that's been helpful, lowering the number in the buses. But again, we've offered a lot of different choices for our students, and we feel that's been a help. Now, again, in Chambersburg, I think they went all virtual, went online, and in Fannett Meadow, they did all back in person. And there's a very low positivity rate in that area. Tuscarora, I believe, went face-to-face K-8, and I believe there's some sort of hybrid in the high school. And Greencastle, I believe, is basically the same as that. They came back to school K-8, and there's a little bit of a hybrid in the high school. So, and they all have made decisions of what's best for their community. And so, but the school districts are struggling, trying to figure out what's best and reflect the needs and the desires of their families.
Thank you, Dr. Kline. That is helpful information about how Franklin County schools are implementing the guidance of Dr. Colli, as well as the guidance from state and federal agencies. Thank you for walking us through this complex and seemingly ever-changing process. Before we wrap up, is there any final message either of you would like to leave our viewers with regarding health and safety for our community?
I'll lead off. I'll just want to mention that, when considering how to reopen schools, it's important to remember that the risk will never be zero. It really wasn't zero before COVID-19. It certainly won't be zero after this pandemic is over. But if the prevalence and positivity rate of COVID-19 in Franklin County allow for some form of in-person education, then I think there are some safe and common sense measures that we can take to ensure that students and staff can coexist in a safe manner, just like Dr. Kline mentioned. We know that there are tremendous benefits to children being educated in person, and both the CDC and AAP have advocated it previously. So let's hope that very soon, all school districts in Franklin County, in the Commonwealth of Pennsylvania, and throughout the country will be able to safely offer some form of in-person education.
And as a follow-up to Dr. Colli, again, I have to agree with everything he's saying, and also to say that it is very much a individual family decision, and that if you look around the county, there are various ways that the districts have dealt with it, and that depended on their certain area. But I also asked families to be very patient with us as we try to venture through this struggle, and we're learning, but we have a long ways to go.
Thank you, Dr. Colli and Dr. Kline, for joining me today. That concludes this video for Franklin Forward FAQ. This series is brought to you by Franklin Forward, a group of local stakeholders committed to turning the COVID-19 pandemic into an opportunity to reimagine Franklin County. To learn more, visit franklinforward.org. If you have any questions about how to safely navigate the ongoing crisis that you would like answered in future episodes, please use the survey link provided with this video. We will see you again next week. Until then, remember, safety doesn't happen to you. You have to do your part.